Although daily reported cases remain at record high levels and continue to underestimate the true number of infections, multiple indicators suggest infections have peaked at the national level, including daily case counts, test positivity, the RT or effective reduction number, and wastewater surveillance trends. As of January the 26th, the 7-day average case count of over 19,000 cases reported daily is a 28% decrease compared to the previous week, and incidence is declining across all age groups. As well, although the latest 7-day average of lab test positivity remained high at 19%, it has been gradually decreasing in recent weeks, including by 14% compared to the previous week. This reassures us that individual efforts, including the layering of personal protections like masking and limiting in-person contacts, together with population-based public health measures to reduce contact rates, are helping to slow transmission and mitigate severe illness trends. Presently, lagging indicators are still rising. Over the same period, an average of close to 10,800 people with COVID-19 are being treated in our hospitals each day, including over 1,200 in intensive care units, and 168 deaths were reported daily. This is why it continues to be important to limit spread as much as possible. Getting up to date with the best available protection for COVID-19 vaccines substantially lowers the risk of severe illness. For those eligible, getting an mRNA booster has been shown to provide additional protection against infection, but most importantly, results in very good protection against severe illness, resulting in hospitalization from Omicron. Health authorities in Canada have continued to monitor vaccine safety data from millions of COVID-19 vaccinations and regularly update vaccine recommendations. This week, Canada's National Advisory Committee on Immunization, or NACI, updated guidance on mRNA vaccination for children aged 5 to 11 years on Tuesday, and for adolescents aged 12 to 17 years today. Children and adolescents remain at low risk of severe outcomes compared to older individuals. However, the substantially higher rates of Omicron infection have resulted in greater number of children with COVID-19 requiring hospitalizations than previously. Hence, NACI's latest advice underscores important opportunities for enhancing protection in these age groups, specifically for those without contraindication to the vaccines. NACI now strongly recommends that children aged 5 to 11 years receive a complete 2-dose primary series of the Pfizer 10 microgram pediatric mRNA COVID-19 vaccine with at least 8 weeks between the first and second dose. NACI is also recommending a 3rd dose for moderately to severely immunocompromised children in this age group. For adolescents aged 12 to 17 years, NACI continues to strongly recommend a complete primary series of mRNA COVID-19 vaccines, including a 3rd dose for those who are moderately to severely immunocompromised. In addition, for adolescents who are at high risk due to biological and/or social risk factors, NACI now recommends a booster dose of an authorized mRNA COVID-19 vaccine may be offered at least 6 months after the completion of a primary COVID-19 vaccine series. These include adolescents aged 12 to 17 years who have an underlying medical condition that may put them at high risk of severe illness due to COVID-19, including those who are immunocompromised and who have already received a 3-dose primary series. Those who are residents of congregate living settings, including shelters, group homes, quarters for migrant workers, correctional facilities, or those belonging to racialized or marginalized communities disproportionately affected by COVID-19. Up-to-date vaccination is recommended for better protection in all eligible people. This is particularly important for parents, guardians, and close contacts in order to help protect children and adolescents who can't be vaccinated or have conditions that place them at risk for severe outcomes. However, as no vaccine is 100% effective, it is important for everyone to continue to use personal protective measures, such as wearing a good quality, snug-fitting mask, avoiding crowding, and improving ventilation in indoor spaces. Thank you. Merci. Megwitch.